My name is Lauren Pace. I'm a fourth-year medical student at University of Maryland, and my project is titled Pelvic Organ Prolapse Content on Pinterest Shows Evidence of Bias and Inconsistency with Best Practices for Treatment. We have no relevant disclosures. So why were we motivated to study prolapse content on Pinterest? Whether we like it or not, social media is being used for the delivery of health information. It evolves on a minute-by-minute basis, and the information is constantly changing. Despite the popularity of Pinterest, academic study of its impact on delivery of health information has been minimal. Prolapse is a common problem with evidence indicating up to 41% of women in the US from 50 to 79 are experiencing it. This is a complex issue, and there are multiple stages and multiple treatments, including but not limited to pessary, physical therapy, and surgical management. Pinterest is a visual discovery engine with the goal of helping users to discover websites and information on topics of interest. It has a majority female user base, particularly those in the age range most affected by prolapse. In the US, it's the fourth most commonly used social networking site among 45 to 64-year-olds and fifth most common among 65 plus. We sought to perform a qualitative analysis of Pinterest content related to prolapse. We hypothesized content would be of low quality with poor understandability and actionability. A Pinterest search for the term pelvic organ prolapse yielded over 300 results, of which we reviewed the top 100. To conduct our review, we adapted methodology from Dr. Stacy Loeb in her paper on prostate cancer content on YouTube. We recorded information about each pin, such as the publisher of the content and the treatment options discussed. We used validated metrics, including patient education materials assessment tool to assess understandability and actionability, and the discern criteria for evaluation of consumer health-related information, which includes questions pertaining to quality. We evaluated for misinformation based on consistency with IUGA ICS Joint Report Guidelines for deciding the discussion and management of prolapse. Finally, we recorded whether posts showed any commercial bias. I'll break down our results based on our research endpoints. Looking at treatment modalities discussed, specific management modalities were mentioned in 89 of 100 pins. We found that pelvic floor physical therapy was the most discussed modality with 79 posts. In terms of quality, we found a fairly even distribution around an average of moderate content. However, it's worth noting that 69 of 100 pins were moderate quality or lower. In terms of understandability and actionability, 75% was our cutoff for differentiating good versus poor PMAT scores. We found 84 pins had good understandability and 70 had good actionability. While we did not find any pin content to have higher than a moderate level of misinformation, 27 pins linked content with information inconsistent with management guidelines. We also found that while a majority of pins did not have overt commercial bias, 36 linked commercial content. The high understandability is perhaps the most interesting here. It implies that Pinterest content on prolapse, perhaps in general, is accessible and easy to understand regardless of health literacy. Lower actionability compared to understandability tells us content isn't consistently providing concrete steps patients can take to obtain evaluation and management of prolapse. Finally, the quality scores imply a general lack of complete and evidence-based information. For misinformation and bias, we keep in mind what our standards are for dissemination of medically pertinent information. Our results beg the question, how much misinformation and bias is too much? At the least, the presence of any misinformation or bias should highlight the importance of shared decision-making between patients and physicians. The big question is what the study can teach us. Based on understandability and accessibility, Pinterest has significant potential as a patient education tool and vehicle for disseminating health information. One of our concerns is the low proportion of physician-created and high-quality content. We feel that based on our results, it's important for doctors to consider patient social media uptake when discussing and counseling treatment options related to prolapse, as it may impact knowledge and prior conceptions. There's also significant opportunity for physicians to begin publishing high-quality content related to prolapse and directed to patients. In conclusion, we wanted to acknowledge the wonderful work of Dr. Stacy Loeb and her team, as their work made ours possible. I would like to thank my co-authors as well. I appreciate your time and attention.